Hi, my name is Presley Taylor, and I've dealt with Lyme disease, autoimmunes, and chronic illness, and chronic pain, and I've healed a lot of it, and I'm here to talk about an important topic. It's UTIs, chronic UTIs, interstitial cystitis, endometriosis, things like that. I've done different videos on TikTok about this, but I really wanted to go in depth. I made a slideshow. I wanted to go in depth about my story, the research, and how I got better from something like this. It's kind of a domino effect. It can be from, one bad UTI infection. For me, it could have been I was more susceptible from Lyme disease, but if you know, bladder issues are the worst, and it is something that I don't think urologists, gynecologists really address properly. So let's get into it. This is UTIs, interstitial cystitis, and what the doctors didn't tell you. So for my agenda, I want to talk to you about my personal story and my timeline with my bladder health and the science behind why this all happened. And then I also want to talk about what worked for me, what got me better, and then some key takeaways. And this is important to me because during my entire journey of having Lyme disease, I didn't actually have that many bladder issues or any bladder issues. I did have Sjogren's syndrome, which is an autoimmune I was diagnosed with, and that made me very thirsty all the time. So I was always drinking water and just peeing a lot, but I didn't have bladder pain UTIs till I actually got a lot better from Lyme. So it was kind of its own issue. And it also correlated to my endometriosis diagnosis. But anyways, let's get into this. So I first just wanted to start it off with the definitions. Chronic UTI is defined by persistent or recurrent urinary tract infections, often with negative standard cultures. So it's like this persistent kind of low-grade UTI, and you're having this pain. It can be characterized by feeling better on antibiotics. If you feel better on antibiotics, you could be having a chronic UTI. Interstitial cystitis is different than a chronic UTI, but it can also be caused by a chronic UTI, and it's basically just chronic bladder pain and chronic urinary symptoms. And it's historically considered non-infectious due to negative cultures, but it's now seen kind of as a trash diagnosis, and usually interstitial cystitis means undiagnosed bladder issues with some kind of infection, but it's basically just bladder symptoms and inflammation. They usually diagnose it with either symptoms that you're having or they go in with a cystoscopy and they see that your bladder wall is inflamed. So let's go to my story. This picture is me in the ER. I had my first UTI in 2024, and I know what caused the UTI. I basically dislocated my knee, and this was the start of all my knee issues, but dislocated my knee, my patella broke, and I, couldn't take a shower for 2 or 3 days because I literally couldn't walk. My knee was 3 times the size it could be, so I wasn't concerned with taking a shower. But then I wake up one night and I go to the bathroom and I'm peeing blood and my bladder feels like it's on fire, and I'm like, what is going on? Because I've never had a UTI before. But anyways, I was having this thing called bladder hemorrhage, which is just as I described, just peeing blood. I took a trip to the ER and they prescribed me a course of antibiotics. And obviously I had a positive culture for E. coli. But after the antibiotics, after I finished them, I felt perfectly fine on the antibiotics. And then when I stopped them, I had kind of this lingering bladder pain. And I went to the gynecologist and she just said, it's probably just inflammation from a bad UTI that you had. Give it time. So I was like, okay, that kind of makes sense. But then I started having recurrent infections. So it wasn't just the pain anymore. I started getting actual UTIs again and going on antibiotics. And this was happening once a month. Like 1 week of the month, I would get a new UTI and I would need to go to urgent care or go to the doctor and treat it and get on a different antibiotic. So eventually I saw 3 gynecologists, 3 urologists. I had a cystoscopy and continued problems. And sometimes my cultures were positive, sometimes they were negative, but I was always having symptoms. So sometimes what was weird is that in the initial urine sample that they took, there would be blood and there would be elevated white blood cells, but then it would come back negative on a culture. So sometimes it would be hard to get antibiotics. And I had constant urgency and also just dilution, which I figured out was correlated to some of the negative cultures. But yeah, I did have cystoscopy, which was not fun. I did have a CT scan of my kidneys to see if anything was wrong with my kidneys. And you can see here in the notes, understands patient's frustration, but explained that although she has bladder symptoms, no obvious pathology, and I see a diagnosis of exclusion. So they were like, they originally thought I did have interstitial cystitis, and then they said, you don't have interstitial cystitis because I didn't have inflammation of my bladder wall. And before I had a negative culture, I had positive cultures from previous months, but just this time around when I saw the urologist and got the cystoscopy, I had a negative culture. And so even though I had positive cultures before, they said, there's no pathology, maybe you're just anxious. Have you tried Neurontin? Have you tried different psychiatric medications, pain medications? And I was like, no, there's a problem. I'm not anxious. I'm anxious about being in pain all the time, having UTIs all the time. So anyways, I realized that I did some research and I realized that cultures can sometimes not be accurate, and that also my specific cultures, my urine was always diluted. It was almost clear. I was always drinking water. I was, that was one thing that helped me, just trying to stay as hydrated as possible. And it was kind of sabotaging the cultures. No one told me that you should drink water and then wait 2 hours and then do a culture to get an accurate concentration of bacteria or whatever. So I did PCR testing, which is you take your bladder, or you take your urine, and you send it to a lab and it detects any genetic material in there. So I had E. coli and Enterococcus genetic material from the PCR. So this is better than cultures because sometimes in cultures not enough bacteria will grow, especially if it's an embedded infection, because it's usually low grade bacteria. When you have a active UTI, it's usually 100,000 CFUs, but when you have a low grade embedded chronic UTI, it can be 10,000 CFUs, and if they see that in a culture, they'll just kind of disregard it and tell you that you're fine. But anyways, the PCR, if you have pathogens in your urine, it'll detect them because it'll detect the DNA that's there. So after this, I was okay, I knew it because I knew there was some kind of infectious problem, because I always felt better on antibiotics. So then I started doing multiple rounds of antibiotics, because on the PCRs, it would show me which antibiotics the bacteria are sensitive to, and I would do a round of antibiotics, have temporary relief, and then the symptoms would return. I would test the PCR again, and the bacteria would be sensitive to different antibiotics. So of course, the bacteria that was staying behind became resistant. This is also kind of known as an embedded infection, and what that means is these E. coli, strep, different bacteria can sometimes embed themselves in your bladder wall, especially if you've had bleeding before, peeing blood and hemorrhaging. Then your bladder wall gets compromised and it can kind of go in there and kind of live there in low levels. And this is a kind of fairly new phenomenon. It has little research, but it is being researched more as there's more cases of it, because as a collective, we're getting resistant to antibiotics, and antibiotics aren't working fully. So it leaves behind bacteria that are embedded that are resistant. Then I also researched bladder pH, what that meant, how that had to do with my infections, and I researched medication called Hiprex. Originally, I was put on a trial of a medication called Urabel, which has Hiprex and methylene blue, but the Hiprex dosage and the methylene blue dosage in the Urabel wasn't strong enough, so I ended up just doing Hiprex by itself with vitamin C. It works a lot better with vitamin C, and then I did methylene blue by itself from my Lyme specialist. I was telling him, like, can you prescribe me methylene blue, because you have to get it through a compounding pharmacy most likely. Like, regular pharmacies don't prescribe methylene blue just as a medication, or at least not to my knowledge. But yeah, I titrated up to 100 milligrams a day, so it's 50 milligrams twice per day. And I also added biofilm disruptors because in these embedded infections, the E. coli, the strep, all these infections can kind of live in these biofilms, so it makes it harder for your immune system to attack them, for antibiotics, stuff like that. So I added things that can disrupt the biofilms. So kind of really quickly, summary of what I just said. Things that helped a lot: PCR testing, and then I didn't mention this yet, but I started doing Rocephin IVs. Rocephin is an antibiotic that you can only get like through a shot or an IV, and it helps people who are having bacteria or pathogens that are resistant to regular antibiotics. And then like I said, I did the methylene blue, the Hiprex, the biofilm breakers, and yeah, the Rocephin, I did 3 months of Rocephin weekly. I would go to my doctor's office, and my doctor's office is a combination of Western and Eastern medicine, but he does take insurance, so I was paying like $100, I think, was my copay for these IVs, which is great, and I was getting Rocephin once a week, and it really helped me because my gut was like destroyed. Like, I couldn't keep taking oral antibiotic rounds for the UTIs. And then with the Rocephin, I did the Hiprex and methylene blue, but I think the Rocephin was necessary before the Hiprex and methylene blue even helped. And yeah, after 3 months, I was able to stop doing that and just do the Hiprex and methylene blue. But occasionally, I will get an active UTI, and so I've used things like nitrofuran and also cephalexin. Those have worked the best for me, and usually it makes it go away. And I know my body pretty well, so I can feel when I'm starting a UTI before it gets to the point where I'm like peeing blood, so I always have those antibiotics on hand if I need them, but rarely do I get a UTI now. It's like once in a 6-month thing, and it used to be once in a month, so I consider that progress. But more of what worked for me later. Let's go into the science. So obviously I had the realization that I never had interstitial cystitis or anxiety that was causing my bladder issues, and I really didn't give up about this because I had Lyme really bad previously before this, and I had gone through the ringer with doctors saying I was depressed, I was anxious, nothing was wrong with me, and then I found out I had Lyme. So I really didn't give up on this issue. Many people do, and it's really sad because many people don't get the medical help necessary, and then they kind of just sit with the diagnosis that they're just anxious or it's in their head. And so that's really sad, and that's why I'm making this video. But yeah, I came to the realization that I had recurrent and embedded UTIs. Let's go into this science. In my understanding as a biology major and someone who loves to research now and loves learning about organisms and systems of the body and stuff like that. So first I learned that there can be some genetic and biochemical factors to being more susceptible to UTIs. Obviously women are more susceptible because the length of our urethra is just shorter than a man, so bacteria that comes from your gut can just easily get up there and crawl up there into your bladder. So unfortunate for us, for sure. But some genetic biochemical factors, sometimes you can have vitamin D receptor mutations, so it can lead to low vitamin D levels and impaired immune peptide that increases your UTI susceptibility. So this is why taking vitamin D, if you have a lot of UTIs, is really beneficial. There's also this thing called CBS mutation, and it can cause elevated ammonia in the bladder, damaging the bladder's protective wall. So it can make you more likely to have embedded infections because your bladder wall isn't as strong. And then hypercoagulant genetics. It's an elevation of lipoproteins found in about 70% of chronic UTI patients. So I never did any of this genetic testing because it's kind of expensive, and I can just do what's beneficial for these things like right now and kind of just assume that I might have some other factors. There's 2 mutations there that can affect glutathione and also estrogen. So for me, I probably have both. I know there's a lot of also genetic mutations in Lyme disease. If you have like lower glutathione and a slower detox system, then maybe like when you get exposed to Lyme disease, you get more sick than another person would. Things like that. But yeah. And this is a methylation map, so this probably looks crazy to a regular person. This is kind of going into biochemistry and their urea cycle, but we'll get into why that's important. This is an image of the bladder structure and how ammonia can damage the bladder. This is kind of what it looks like. And again, mentioning the biofilms, it's protective bacterial communities hiding in this like fiber, and it can make it harder for your immune system or antibiotics to really kill them. So that's scary. And a lot of people who have chronic infection, chronic Lyme, chronic UTIs, chronic whatever, have a lot of biofilms. Biofilms allow these infections to persist, and they cause reoccurrent symptoms. So we'll go into how to break the biofilms and get rid of those. A little more on why standard urine culture can be negative. Sometimes the bacteria doesn't survive in the time, like it's slow growing. So when they have it in the culture and in the room where they're culturing the bacteria, sometimes it doesn't grow. Sometimes it's over diluted. Sometimes it's in biofilms and it's not actually in your urine. It's in your bladder wall. There's a lot of different reasons here. And this can miss up to 30% of pathogens, and we still have the same diagnostics. I'm very passionate about diagnostics because it's the same for Lyme. Like some of the standard Lyme disease testing is 40 to 60% inaccurate, and who tells you that? As a patient, we're supposed to be able to trust doctors, and we think that these diagnostics, in modern medicine should be like 99% effective, but sometimes they're not. So we don't get told that, and that's frustrating. But yeah, this is advanced molecular testing that is great if you have UTIs, and this is one that I do recommend getting and that I did get myself. Microgenics and MDL both has PCR, which is the number one test I recommend. If you're going to do anything, do that. There's also next generation sequencing, which is kind of similar, and also specimen preparation. For a microbial landscape for UTIs, Enterococcus is actually one of the most common bacteria to cause this kind of chronic UTI pain. And if you don't know what Enterococcus is, it's a type of strep that lives in your gut, and it can live in your bladder too, just like E. coli can live in your bladder, and it comes, from your gut. And then mycoplasma and uriplasma, this isn't usually tested for. I would really recommend getting this test as well. because this is a opportunistic bacteria, and there's more research coming out about it being an STI and an STD, because most kids don't have it and sexually active adults have it. And for a while it was just considered a natural part of the microbiome, but now we are seeing research that it can cause inflammation, infertility, etc. So this is definitely one that even if you get STD tested, sometimes they don't include it. So I would recommend getting tested for this. And then also fungal pathogens can cause worsening symptoms. It can cause your bladder to just be inflamed and irritated, and I definitely dealt with this after I've had way too many antibiotics in my life and treating Lyme and everything. So I've gotten thrush and I get vaginal yeast infections, and like I just have an imbalance of candida, or I used to. So this is also something that you can treat if you have bad UTIs. And then a little less common, but again, if you have like Lyme disease or tick-borne infections, it can make you sometimes more susceptible. I think if you have Lyme, it makes you more susceptible to kind of everything. So that's a big bummer. And then viral and parasite involvement in the bladder is pretty rare, so you don't have to really worry about that. But yeah, again, going over the reinfection factors and like why you get chronic UTIs. We have genetic susceptibility, antibiotic use that causes resistance, partner reinfection, which again can be things like uriplasm, mycoplasm, stuff like that. So maybe you're getting treated for something, but your partner is reintroducing it. And actually bacterial vaginosis was just proven to be sexually transmitted. So there's a lot of things that you might not think are sexually transmitted, but they are. So you need to, if you're treating something, you also need to make sure your partner doesn't have it. And then also hormonal imbalances, especially in women, can make bladder issues. And then some associated conditions, fibromyalgia, mast cell activation syndrome, which I have, and it just is basically like an allergic reaction forever. It's just like crazy. Ehlers-Danlos syndrome, oxalates, and mold and mycotoxins, these can all be associated conditions. And I do think when you have a chronic condition, or you're at the point where you have chronic symptoms, you usually have multiple factors playing in. Our bodies are really resilient, so I think if anyone's dealing with a chronic health issue, there's multiple factors like mold, fungus, bacteria, parasites, like multiple things kind of attacking your body. It usually doesn't take one thing. I also wanted to add endometriosis to this list and PCOS. I have dealt with endometriosis and PCOS, and I can say that after my endometriosis surgery, a lot of my bladder issues did get better, but not all of them. And so a lot of my bladder issues were caused by the bacteria, but the endometriosis didn't help, if that makes sense. So what works? Here are my treatment strategies. We're getting into the good stuff. So first of all, infection eradication. That's like the number one thing. So for antibiotics, I really just recommend like doing IVs if possible. And if you do oral antibiotics, don't do them short term, do them longer. Try to find a doctor, like print out a research article and try to find a doctor that'll prescribe you antibiotics for up to 2 weeks, so it can really kill a lot of the bacteria, because when you do antibiotics in short term, it leaves some bacteria, and sometimes like it's just not enough. Bladder installations, I tried this with just there's bladder installations with saline, and I didn't like it. I didn't think it helped me, but there is a thing with bladder installations and antibiotics, and that could mean antibiotics go directly to your bladder and don't have to damage your gut, and that could be useful. I never tried that, but it's worth noting. Herbals, I'll share some supplements and herbals that I love. I love herbals just for so many things, but yeah, they're really helpful for UTIs. And again, partner treatment if that applies to you. So here's a list of biofilm disruptors and supportive therapies. So first, we have our enzymes, vitamin D supplementation, glutathione, probiotics, and then other lifestyle things like infrared saunas, binders, things to just help you be healthy. So here are the supplements that helped a lot. Like I mentioned, Hiprex, methylene blue, taking liposomal vitamin C with the Hiprex, and then taking like Biosid and LSF or the Interface Plus from Therabiotic, taking them on an empty stomach, and waiting an hour to take anything else, and taking your biofilm breakers before you do, say, like your methylene blue or your Hiprex or something antimicrobial. So it can expose the pathogens and then you can attack the pathogens. Also, Golden Seal really helped me. I just kind of like tried that on my own. I think I saw a girl on TikTok talking about it and it helped me. Doing vitamin D, but making sure you pair it with K2, because vitamin D isn't that absorbable on its own. Urinary X from Life Seasons, I love this supplement for yeast and urinary support. Uva Ursi is also a good tincture specific to the bladder. And then you have your orthodine, which again goes back to the ammonia and the bladder wall. And then I love this probiotic, medical grade probiotics. You have your NRF2 detox, which goes back to the methylation and all the biochemical stuff, and then glutathione, which is great for the bladder, and then the other biofilm breaker enzyme. So here's a entire list of the supplements you can copy and paste. I also have on my Amazon, if you go to my Amazon, I have all these supplements linked conveniently for you, because sometimes it's hard to know where to get them. I used to get a lot of my supplements from FullScript, but FullScript shipping was just too expensive and it took too long. So now I usually get my supplements from Amazon. I just make sure they're from the correct seller. Also, something I want to note is that for me, I had a large correlation with gut dysbiosis from UTIs. Like I just would have gut issues, like I would have like diarrhea or something like that, and then I would see myself getting a UTI. My endometriosis doctor recommended this to me, but every time you have a bowel movement, you should shower, and if you can't shower, you should use wet wipes with hydrochloric acid spray. So hydrochloric acid spray is antimicrobial. I use it all the time. It's safe to use, and you can just spray it on a wet wipe. So this is like kind of TMI advice, but I don't really care because I want to help you guys. But yeah, the last thing I want to end off with is long-term management. So kind of summarizing this video, if you have the genetic markers, or if you think you have the genetic markers, just kind of doing a lot of supplementation for long term of enzymes and vitamin D, and then also ongoing orthodine use for the ammonia in your bladder, and then prevention, something like I talked about, like if you have gut dysbiosis or every time you have a bowel movement, making sure it's super clean, and then obviously being more healthy in general is going to help you. So having a good diet, exercising, ongoing self-care, things like that, because everything adds up in the end. So that's my very, very in-depth video. And I still feel like it could go more in depth, but I hope this helped. Let me know if you have any questions, and I'll see you next time.